Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about Hyperemesis Gravidarum. Let's get started. Nausea and vomiting are super common in early pregnancy. Most people know it as morning sickness. But sometimes, the vomiting becomes very strong and doesn't stop. When it leads to dehydration, weight loss, and makes it hard for the mother to stay healthy, it's called Hyperemesis Gravidarum. Hyperemesis Gravidarum basically means extreme vomiting during pregnancy. So intense that it affects the mother's nutrition, energy levels, and overall well-being. Now let us see about the definition. Hyperemesis gravidarum is severe, persistent vomiting during pregnancy that leads to dehydration, electrolyte imbalance, weight loss, and nutritional deficiency. Now let us see about the incidence. Hyperemesis gravidarum is not very common. It happens in about 0.3% to 2% of all pregnancies. It usually starts early, around 6 to 12 weeks. It is more likely to happen if it's the woman's first pregnancy, if she is carrying twins or more, or in conditions like a molar pregnancy. Now let us see about the causes. Hyperemesis gravidarum can happen due to changes in the body during pregnancy. One major reason is hormonal changes, especially high levels of HCG and estrogen, which can trigger severe vomiting. Emotional factors can also play a role. Stress, fear, anxiety, or not having enough support from family or a partner may make the condition worse. Together, these hormonal and psychological factors can lead to persistent and severe vomiting in pregnancy. End P. Now let us see more about the causes. Gastrointestinal problems can also contribute to hyperemesis gravidarum. Some women may have delayed stomach emptying or acid reflux, which can make nausea and vomiting worse. Other factors can also increase the risk, such as a molar pregnancy, carrying twins or more, and certain genetic or metabolic conditions. All these factors together can make the vomiting more severe and harder to control during pregnancy. Now let us see about the pathophysiology. In hyperemesis gravidarum, the levels of hormones like HCG and estrogen become very high, which can stimulate the vomiting center in the brain and cause continuous vomiting. When vomiting happens again and again, the body loses important fluids and electrolytes, such as sodium, potassium, and chloride. This leads to dehydration, ketosis, and weight loss. If the condition becomes severe, it can cause metabolic imbalances and serious nutritional deficiencies because the body is not getting the nutrients it needs. Now let us see about the signs and symptoms. In hyperemesis gravidarum, the main problem is persistent vomiting, which makes it difficult for the mother to eat or drink. This leads to general symptoms like weakness, tiredness, and noticeable weight loss. Because so much fluid is lost, dehydration signs appear, such as a dry tongue, sunken eyes, and very little urine output. The circulatory system is also affected, causing a fast heartbeat and low blood pressure. Metabolic changes occur too, where ketones appear in the urine and important electrolytes become imbalanced. In very severe cases, the brain can be affected, leading to drowsiness, confusion, or, rarely, even coma. All these symptoms show how serious the condition can become if not treated properly. Hyperemesis gravidarum can cause several problems for the mother if it is not treated early. Because of continuous vomiting, she can become severely dehydrated and develop electrolyte imbalances, especially low potassium. This can lead to malnutrition, since the body is not getting enough nutrients. In very severe cases, a deficiency of vitamin B1 may cause a condition called Wernicke's encephalopathy, which affects the brain. The liver and kidneys may also become stressed and not function properly. For the baby, the lack of proper nutrition and dehydration in the mother can lead to complications like intrauterine growth restriction, preterm labor, and low birth weight. These complications show the importance of early care and proper treatment. Now let us see how hyperemesis gravidarum is diagnosed. First, the doctor takes a detailed history by asking about how long the vomiting has been happening, and how severe it is. They also check the mother's food intake, any weight loss, and how much urine she is passing to understand her hydration level. After that, a physical examination is done. The doctor looks for signs of dehydration, measures the mother's weight, and checks her pulse and blood pressure. All these steps help in confirming the condition and deciding the right treatment. Now let us see about the laboratory investigations. To confirm Hyperemesis gravidarum and check its severity, doctors usually start with a urine test to look for ketones and measure the specific gravity, which helps show dehydration. Blood tests are also important to check electrolyte levels like sodium, potassium, and chloride, as well as hematocrit and kidney function. Liver function tests may be done to see if the condition is affecting the liver. An ultrasound is also performed to rule out conditions such as molar pregnancy or multiple gestation, which can increase the risk of severe vomiting. Now let us see about the management of severe cases. When hyperemesis gravidarum becomes serious, the mother may need hospital care. She is kept in a quiet and well-ventilated room so she can rest comfortably. The emotional support and reassurance are also very important, as the condition can be stressful. The main focus in the hospital is to correct fluid and electrolyte loss. IV fluids such as normal saline, Ringer's lactate or 5% dextrose are given, and potassium chloride is added if needed. A strict intake and output chart is maintained to keep track of how much fluid the mother is receiving and how much she is losing. This helps ensure proper hydration and stable electrolyte balance. Now, let us see about the medications and nutritional management. To control the vomiting, doctors may prescribe antiemetic medicines such as ondansetron or metoclopramide. Vitamin supplements also play an important role. Vitamin B6 is often given, and thiamine, vitamin B1, must be given before any glucose to prevent a serious complication called Wernicke's encephalopathy. Once the vomiting starts to settle, the mother can slowly begin taking fluids by mouth. After that, she can move on to a soft and bland diet, like biscuits, toast, or rice. Eating small, frequent meals helps the stomach tolerate food better and supports recovery. Now let us see about psychological support and home management. Providing a calm and supportive environment is very important for mothers with hyperemesis gravidarum. They should be encouraged to share their worries or fears, as emotional stress can make the condition worse. For mild cases managed at home, rest and proper sleep are essential. Eating small, frequent meals and avoiding fatty or spicy foods can help reduce nausea. Taking dry toast or crackers before getting out of bed in the morning often helps settle the stomach. Drinking cold fluids and staying away from strong smells can also ease symptoms. Regular antenatal checkups should be continued to monitor the mother's health and ensure the condition is improving. Now let us see about the nursing management of hyperemesis gravidarum. Nurses begin by assessing how severe the vomiting is and checking the mother's hydration status, which helps in planning care and identifying complications early. Vital signs and weight are monitored daily to track the mother's progress. An intake and output chart is maintained to keep a close watch on fluid balance. Nurses also provide IV fluids and medications as prescribed to restore hydration and correct electrolyte imbalances. Emotional support is an important part of care because it helps reduce anxiety and supports recovery. Finally, nurses educate the mother about proper diet and home care practices to prevent the problem from recurring. Now let us see the health education for the mother. It is important for her to take plenty of rest and avoid stress, as both can worsen the symptoms. Eating small, frequent, and bland meals helps keep the stomach settled. She should stay away from strong smells, fatty foods, and should not let her stomach remain empty for long. Drinking fluids between meals, not during meals, can help reduce nausea. She must report to the healthcare provider immediately if the vomiting becomes severe or if her urine output decreases, as these are warning signs. Finally, continuing regular antenatal checkups is very important to monitor both her health and the baby's growth. Now let us see the prognosis. Hyperemesis gravidarum usually improves by around 20 weeks of pregnancy, and most mothers start feeling much better after this period. With proper treatment and good follow-up care, both the mother and the baby recover well and stay healthy. However, if the condition is severe and left untreated, it can lead to complications, which is why early medical attention is very important. Hyperemesis gravidarum is simply severe and persistent vomiting during pregnancy. It can lead to dehydration, electrolyte imbalance, and malnutrition if not managed properly. Treatment mainly focuses on rehydration, proper rest, antiemetic medications, and providing psychological support. Nurses play an important role in observing the mother's condition, managing fluids, and giving essential health education. With the right care, most mothers recover well and continue a healthy pregnancy. That brings us to the end of today's session on Hyperemesis gravidarum. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.